Okay, I think in the interest of time, we should get started. I don't want to get you behind for anything else. So I'm Jean Harvey Borino. I'm on the faculty at the University of Vermont, and I have been doing obesity treatment and prevention research for many years, which is why I assume they keep asking me to come back and give this talk over and over again. I also should say that I am a cancer survivor, so when I sometimes use the royal we, I do mean, we collectively in this room, which is why you'll hear me say that from time to time. So I get asked to talk about the relationship between weight gain and cancer, breast cancer specifically, treatment, what we know about it, and then what you can maybe think about doing about it if you are so afflicted. So I'm going to start by just giving an overview of what we understand the problem is and what we understand more or less about why we have this particular problem. I should also say that Kim Didis, who is an oncologist that many of you may know and is someone that I work with and do research with, is giving a talk later this afternoon. It's directed towards primary care physicians, but if you feel like you want to dive deeper into the biology of what we know about this current issue, please go see Kim's talk at 1:15. I'm going to stay on the surface here a little bit more. So we know that weight gain is a common and persistent problem for many breast cancer survivors. The amount of weight gained can be substantial, and weight gain is more likely in women receiving chemotherapy, but not only in women receiving chemotherapy, I should say. We also know that this weight gain is accompanied by unfavorable body composition changes, and I will describe what those are. So that's really the statement of the problem. So what is the frequency and the magnitude of this weight gain? And remember, when I go over these statistics, they're always averages for population groups, averages in studies. It doesn't mean that this necessarily will or did happen to you specifically. Between 50 and 69%, and the range is because different studies find different things, between 50 and 69% of early stage breast cancer patients gain weight during treatment. So the frequency of this weight gain has not changed over time. The good news is the magnitude of the weight gain has actually changed. That's good news. In the 1990s, a weight gain of between 5 and 14 pounds was common, and a gain of greater than 20 pounds was not unusual. That was in the 90s. In the 2000s, we've seen the magnitude of that gain decrease so that 34% of individuals were gaining over 5 pounds. And a study in the year 2011 suggests, again, that roughly 60% of women gain, but only really less than a quarter gain over 5 kilograms, which is roughly 10 pounds. Okay, so the frequency of the number of women that are gaining is roughly the same through time, but the magnitude of the gain is different. And we think that that may have something to do with changes in chemotherapy drugs over time. That may be one of the reasons. Okay. So the other thing that we know is that the weight gain may be progressive, that there isn't any finite period of time, it seems, when you stop gaining. So in other words, if you escape gaining 3 months after treatment, then you're good to go. That's unfortunately not true. It does seem that even 3 years after treatment, women can continue to gain a little bit. I mean, you do see that it starts to level off. But it's not like when you finish all of your treatment, it's necessarily over. So there is a slow progression of gain after treatment even ends. And so that 68% of women in one study have gained 8 pounds by year 3, 8+ pounds by year 3. So this is the average, 6.2 pounds, but there is a percentage of women, again, that will gain more than that. Okay. We also know that there's some variability in the timing of the gain. So it can be during chemo, after chemo, sometime before chemo, after surgery. It doesn't necessarily always happen at the same time. Ethnicity may make a difference in that certain ethnic groups are more prone to gain weight than others. And if you compare breast cancer patients to same age women in the general population, you can see that the weight gain during a certain period of time is greater in breast cancer patients than it is in women in the general population. And we do that comparison because, as you're probably aware, we all, meaning we, men and women, tend to gain weight over time. It's just something that happens with age. So the question would be, well, is this an aging thing? You know, you're telling us we gain weight over a 3-year period. I'm also getting older. Well, it's accelerated. The gain is accelerated from what you would see in the general population, even over the same period of time, if you compare the same age women, et cetera, et cetera. Okay. So what did I mean about the body composition changes? What are the characteristics of this particular weight gain? So there does appear to be an increase in body fat. You know, when you step on the scale, it gives you a number that really is associated just with how much you weigh, but it doesn't tell you how much of you is fat and how much of you is muscle and how much of you is, you know, the weight of your hair, which would not be the case after chemo, of course. But, you know, it just gives you a number, right? So what is that number composed of? If you do further studies and you look at body composition, it does seem that the weight gain in women with breast cancer is more body fat, and there does seem to be a concomitant decrease in muscle mass. So you lose muscle mass and increase body fatness, and interestingly enough, we see this shift in body composition in women who don't even gain. Okay, so you could stay the same weight, and you're losing muscle when you go through treatment and gaining fat. Okay, so you're shifting your body composition, the proportion of your body components. You may not even have gained weight. Okay, so there's something about cancer treatment, again, we think particularly chemotherapy, that precipitates this change. We do see longer treatment results in more weight gain. So the longer you have chemo, the more weight you gain, which again is another clue to us that chemo has something to do with this generally. You gain more weight if you're premenopausal before you start treatment than if you're postmenopausal. However, we do also see weight gain in women who don't have chemo, okay? And so, you know, we also see weight gain persisting, as I said, in women who have finished treatment who are survivors. And so it's not just during the time that you have chemo, and that makes us ask some questions about what lifestyle change has to do with this, right? So we know that cancer treatment is very fatiguing. Is it that you're getting very tired and you're not moving around as much, you're not expending as much energy, you're not exercising maybe like you used to or at all because you're too tired? And there is something that, you know, I tend to think of as the I have chemo, I deserve a cookie effect, right? And so how much of it, right? I was there again, I was there, I remember, okay? So how much of it is this sense that, you know, you might have been somewhat of a restrained eater before, paid more attention to what you were eating, and you get cancer and go, forget it, you know, I'm gonna have the damn cookie, right? So we don't have good answers to this. We really don't know exactly what's going on, which is a little bit troubling. Because generally, when we talk about weight change, you know, it is, and I'm going to make this sound very simple, it's not this simple, of course, but it is generally a balance. Your weight is a reflection of the balance of the amount of calories that you take into your body in terms of food, energy, and the amount of energy you expend in physical activity, in the amount of calories your body expends just for you to breathe at rest, okay, and you expend a little bit of calories by eating. You know, your body expends calories just by digesting your food, but the only way to increase that is to eat more, so that's really not a good option, right? So, you know, you look at the balance between energy input and energy expenditure, and so what's happening with breast cancer patients? We don't really know, okay? So we haven't really had this definitive study looking at very objective ways to measure intake and expenditure to try to figure out exactly what's going on. I can also tell you that one of the things that changes the amount of calories you spend at rest is how much muscle you have. Okay, so muscle is more metabolically active. It takes more energy to maintain a certain amount of muscle mass than it does to maintain a certain amount of fat mass. So if you're losing muscle as you go through treatment, that's going to change your resting energy expenditure, okay? So whether you change what you're eating or not, you could be changing your energy balance because your body composition is changing. So all those things are probably going on. We just don't know what is the greatest contributor to all of this. Okay. So what are the health consequences of the weight gain? Again, this is something that Kim will talk more about this afternoon if you're interested in hearing this. There is some equivocal data on whether or not the weight gain that you might experience will increase your chance for recurrence or result in a poorer prognosis for you long term. The last time I looked at the studies, some of them said yes, some of them said no, and I don't really know exactly where we are with that argument. Kim would probably know better. But that aside, gaining weight is bad for you. Okay? It's bad for you for 100 reasons. You have poor quality of life. Many people feel that they can't do the things that they used to do. They don't feel very good about themselves. There's a loss of self-esteem. You have an increased risk for other chronic diseases, hypertension, diabetes, the list kind of goes on. So whether or not we have a firm answer on your breast cancer risk, there are other reasons why it's not a good thing. It is also the case that gaining weight is a constant reminder of your illness and the treatment that you went through, right? It's a constant, post-traumatic cancer treatment disorder thing that every day you look in the mirror, aside from the fact that your hairs may be growing back, looks different. Other parts of you look different. You have scars that you didn't have before. And now you've got 10 extra pounds, right? That faces you every day you look in the mirror. So it's not, it's not a good thing for 100 reasons. Okay. Because of all of this, because of the evidence of all of this information about weight gain and weight change and cancer treatment, the American Cancer Society has said that weight management should be a standard of care for overweight women with early stage breast cancer, okay? And it doesn't always happen, right? Okay, I think that we're doing a much better job at Fletcher Allen addressing this issue, but if you go out there in the world, you will find that weight management intervention is not supported usually by insurance companies. So even though there's a call for this to be standard of care, it doesn't always happen as it should. Okay? So then where are we? So breast cancer treatment is associated with weight gain, covered that. This weight gain is characterized by a loss of muscle and an increase of body fat. There's no clear explanation for why this occurs. Okay? But we do know that intentional weight loss does result in a decreased incidence of cancer, particularly female obesity-related cancers. And we would see this from large epidemiological studies where people were told to lose weight or change their diet, probably for other reasons that didn't necessarily have to do with cancer prevention. When they go back and measure them 10 years later, they find, the people that lost weight during the time of this trial actually had less cancer ultimately. Okay, so that gives us a little clue about if you do gain it, if you lose it, you can improve your chances, improve your risk for various things. Okay, so then the question is, well, what can you do? All right, so it would be nice to know before you started treatment or at diagnosis that this is something that might happen to you. Okay, so I knew this was something that might happen to me, so I was extra careful and was very careful about my weight. I didn't gain weight, but I did have changes in my body composition, right? So it'd be great if you knew, but if you don't know, and here you are, and you've gained some weight during treatment, which again is very common, what are your options? So I would say the first thing to do is consider your options. And you may decide on balance, if you think about, well, what could I do to manage my weight? Should I bother doing that now? You may decide that you're just too overwhelmed with everything else to really think about it right now. It is not an easy process. It is possible. Kim and I, as I said, have been doing some research on this. We have found that women after treatment can certainly lose weight. There's nothing about having gone through breast cancer or having gone through treatment that makes it impossible for you to lose weight. Okay, so know that. It's just that it is not easy for anybody, and if you're closer to treatment, you may feel still a little bit exhausted and not want to consider it. So you have to really think about what you may get from considering this, what you'll give up. Okay, so the pros and cons. Okay. I would also encourage you then to set some goals after you've thought through this. So what is your goal? Is it prevention of more weight gain? Staying the same? Is it actual weight loss? Okay. If it's weight loss, then a good goal is what we recommend anyway, is thinking about not losing more than 1 to 2 pounds a week. Okay, so that's a slow, steady progression of weight loss. Losing more quickly than that, usually means that you're losing more muscle and not as much fat. And remember, you want to optimize the amount of fat you lose and minimize the amount of muscle you lose. So you want to lose weight slowly. Okay. And then consider your weight history, right? So if you never weighed 120, you're not going to weigh 120, right? So consider where you were, maybe before treatment. Consider what your lifetime weight was. Consider what your family history is. Think about all of that when you try to set a reasonable weight change goal. In terms of actually setting weekly goals, though, incremental weekly goals, even daily goals for weight loss, you want to think about managing your calories, right? So as I said, it's energy in and energy expended in the form of usually physical activity. That's the only control you have over your expenditure. And the way we tend to think about this is by doing a simple calculation. This sounds very rough, but it works. So if you want to try to figure out what a weight change or a calorie goal might be for you, you take your weight now in pounds and you multiply it by 12. And that's a very rough estimate of the amount of calories that you're probably consuming right now to maintain the weight that you are right now. Okay, that assumes that you're not losing and you're not gaining, so that's a big assumption, but it's just a rule of thumb. Okay, so if you do that math, then you have an amount of calories that you're probably consuming, and in order to lose weight, you want to take calories away from that number. Okay, so if you subtract 500 calories a day from that number, you should lose roughly a pound a week. If you subtract 1,000 calories away from that number every day, you should lose about 2 pounds a week. Again, very rough guideline, but it tends to work. Okay? So that gives you sort of a global something to shoot for so that you have some idea of what you might want to do, assuming that you've decided to go forward with this. Okay? And then, what we ask people to do is really think about what their behaviors are. So, get your sights set on the weight loss, right? And so if you set your sights only on the amount of weight that you want to lose, on the poundage, you decide, for example, that you want to lose 50 pounds. Every day you wake up, you will be disappointed, right? You may be very happy in 6 months or 7 months or 12 months, but every day you wake up, you will be disappointed. Okay, not a good goal. Okay, so a behavioral goals need to be very specific. Something that you can achieve, something that you can meet, something that's going to get you towards your goal of losing 50 pounds, but something that will make you feel good that you're making progress. Okay, so we work a lot on treatment and helping people set realistic, achievable goals, right? So my goal is to walk on Monday, Wednesday, and Friday with my friend Rita for 30 minutes before dinner. That's a very specific, achievable goal. You know whether you did it or not, right? I'm only going to drink diet instead of regular soda this week. Okay? So those are all things that will help you either expend calories or decrease the amount of calories you're taking in. Again, if your only goal is on weight loss, you will be disappointed. Okay? All right. So then the big question becomes what kind of calories, right? So you talk about energy balance, you're talking about calories, yeah, but what? What am I supposed to choose to eat? I would just implore you to read labels. You can see what the calories are for these foods. Have you seen the calories in Starbucks for the different? Yeah, okay, it's horrifying, right? Horrifying. It's really horrifying. And unfortunately, reading these labels doesn't really seem to affect behavior in the way that all of us in public health, hoped that it would. But so there you have it. So what kind of calories? I'm going to walk you through. This was a study that was done looking at different kinds of diets. So people were put on different weight loss diets. They were put on the Atkins diet, which you're probably familiar with, the high protein, high fat diet where you can eat bacon all day long. The zone diet, which is more of a moderate, 30-30-20 or 30-40-20 or whatever it is, where you have a moderate amount of carbohydrate, protein, and fat, so it's spread out. And then the Ornish diet, which is a very, 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 very low-fat diet, So only 10% of your calories are supposed to come from fat, which means that you can't buy store-bought bread. You have to make it yourself. You can't use any extra oil. It's really very extreme, right? So they compared these 3 diets, And what they found is that, Atkins produced better weight loss in the short term, if you really want to know the head-to-head comparison of how they worked. Really what we're seeing, though, is that people that were the most adherent in the red bars to whatever the diet was did the best, okay? Most adherent versus least adherent. People that were the most adherent to whatever diet they were following did the best, okay? And so what we know, right, and this is just one study, but if you look across many studies comparing high protein, high fat, high carbohydrate, it doesn't matter. If you stick to it, it works, okay? So all of these diets work in some way to control your calorie intake or you wouldn't lose weight, right? But it has to be something that you're willing to do for the long term. And Atkins is good at controlling calories in the short term, but people usually can't keep it up for very long. So think about that. It's what you can most adhere to without any other information. In fact, I teach a course on obesity that I haven't taught for a number of years, and I'm teaching it again this year for the first time in 3 years. And my former doctoral student taught it for 3 years. And so when she was teaching it, she found all these articles and things that she would show to the class. And so she took my slides and she updated them. Well, one of the articles that she found for the students was about a professor, and I'm forgetting where he was, I think at Cornell, who lost 27 pounds by following a Twinkie diet. Okay? And so he was wondering whether it was the quality of the diet that mattered or whether it was just the weight loss. And I will tell you, it was just the weight loss. He lost 27 pounds. He went from the overweight range to the kind of healthy BMI range. He had his metabolic profile done, his lipids improved, his blood pressure improved, all these things improved. Twinkies, seriously. Okay, so I wouldn't necessarily say, what? I know, it's just horrible. So I would not recommend that necessarily. He was trying to prove a point, right? And, of course, we don't know about a lot of other things like long-term cancer risk if you follow that kind of diet and just a million other things. But, I think the argument is that weight loss is so powerful, that it's a diet that you can stick with, which also means that, having an occasional Twinkie is okay, right? There are no foods that necessarily can't fit. There might be foods I could argue you shouldn't fit, but whatever, right? Like Twinkie's not a food, right? I would say that, but that just illustrates a point, right? Okay, so how do you know whether or not, you set these goals, they're measurable goals, they're specific goals, you've really worked hard to try to figure this out. How do you know whether you're meeting them? Well, you have to track yourself. And this is a horrific pain in the ass, right? There's no way to make this easier. There's just no way. So you can either write things down with a paper and pencil, which still works, and in which case you probably need some kind of a calorie fat gram, book, so you can look up the calorie counts and things. It also is perfectly reasonable to look at packages and use the calories on packages. To buy a cookbook that already has the calories figured out for you, that's really the easiest way to go, because trying to identify the calories in a recipe is really totally a pain. You can also weigh and measure your food, and I suggest that you do that. Portion size being one of the things that we are not very good at estimating, any of us, including dietitians like myself. And for exercise, weighing yourself frequently is also a really good thing to do. And then for exercise, getting something like a simple pedometer, which measures the amount of steps that you do, is also really helpful, because I think sometimes we think that we're more active than we are. Research suggests that we eat more than we think we do and we exercise less than we think we do. So all of these are ways to be certain that you know exactly what you're doing. You don't know what you're doing unless you track it, look it up, write it down. There certainly are a lot of fancier apps for your phone. You can track with those. You can wear devices that will measure how much energy you're expending, more or less, in physical activity. But simple also works. It doesn't have to be fancy. Okay, so what about just eating goals in general, okay? So if you don't want to look up calories, you don't want to take the time to do that, I would say that there are a couple other things to keep in mind that are simple strategies. One is to think about portion size, which is why for a while, even if you don't want to do it long term, which I would suggest, but if you don't want to do it long term, weighing and measuring your food for a while is very instructive in terms of figuring out what portions you're eating and whether you're eating more than one portion. So, portion sizes have increased dramatically, And if you are my age, you remember when bagels were this size, right? And we used to, as a dietitian, we always used to say that a bagel was the equivalent of 2 slices of bread. And it was at 140 calories and a 3-inch diameter, right? Remember the Lender's bagels in the package? Okay, that's what a bagel was. Big as a hockey puck. Look at this, okay? That's the bagel. You go to Dunkin' Donuts or wherever, they're as big as your head, right? I mean, seriously, they're like, they're this big. So this is 350 calories. That's a lot of slice. That's like 5 slices of bread, okay? So it's not that you shouldn't eat the bagel, but know that when you're eating the bagel, you're eating 5 slices of bread, okay? So just know that when you do it, right? Hamburgers, this is the data. Hamburgers used to be 1 ounce. When McDonald's first started making hamburgers and selling them to the public, they were 1 ounce. 1 ounce, okay? That's like a quarter size, right? So look at it now. Okay, 590, that would be sort of an average. And of course, you know that there are many more calories than that depending on where you get them and what you get on them. Coffee used to be just coffee. Okay, now it's not, right? So you can easily look up how many calories are in your coffee drinks. And I should say that, beverages are a big issue, right? So there are a lot of calories that are consumed in beverages. In healthy juices, read the labels, Fresh Samantha or whatever they're called, those bottles can be over 200 calories a bottle. It's all calories count. And one of the problems with beverages is that your body does not register the calories consumed from beverages in the same way that it does from calories that you eat. Okay, so there was this fascinating study that was done where they gave people a sugar-sweetened beverage to drink that was maybe 200 calories, and they matched the calories and gave another group of people jelly beans instead. So one group was eating pure sugar that they had to chew and swallow, and the other group was drinking the pure sugar that they had to just swallow without chewing, right? So the people that got the jelly beans compensated for those calories later in the day by eating a little bit less because they had registered that they ate something. The people that drank the calories did not compensate later in the day. So your brain does not register the calories from beverages in the same way. Be very careful of the calories that you're drinking, okay? All right. So eating mindfully is the other thing that we don't do, right? Okay, so how many of us, stand up in the kitchen and we eat while we're cooking and we're shoving things in our mouths and you just don't think about it, right? So that's the other thing about writing things down. Even though it's a pain to keep track of your calorie intake, it will force you to write down every jelly bean for a while. And you'll say, wow, I had no idea I ate 10 jelly beans before lunch, and 10 jelly beans is probably 100 calories, okay? So there's a lot of information about, how many calories are in 2 bites of a brownie and how many calories are in a handful of pretzels and a handful of peanuts and these things that you just don't even think about, right, that will add up throughout the day. So eat mindfully. Even if you don't want to be obsessive about writing things down and looking them up, start with this. I mean, even if all you do is write down the food that you're eating and the time of day, to try to register patterns of consumption without looking up the calories, that can be really helpful because you might see that, I eat a lot after dinner. I really was not aware of that. Or I eat a lot right before lunch. Maybe I should just eat lunch earlier, and then I wouldn't be consuming all these extra calories. All right. Eating out is another big pitfall. And so, when you eat out, as you know, you don't really know what you're getting. And this was a study that was done by a newspaper in Seattle where they got different menu items from these different chain restaurants, and they were chain restaurants that had listed the amount of fat in the particular menu items. So they took these items and they took them to an independent lab and they got them tested and found that at Macaroni Grill, this particular dish said it had 6 grams of fat. It had 49, okay? This one was 14 versus 35. This is 4.5 versus 20. Okay, so that's clearly going to change the amount of calories that are in these items. That much more fat is going to be a lot more calories. And so you don't ever really know how many calories are in what you're eating in a restaurant. There certainly are guidelines about what you can try to choose, but the more you eat out, the more frequently you eat out, the more you are consuming probably extra calories that you don't plan on, even if you try to be careful So just limiting the amount that you eat out is another strategy that doesn't necessarily require you to write down a lot of things and look up a lot of things. Okay, so then, I would say that exercise is clearly a critically important part of your treatment and recovery. Whether you're thinking about weight management or not, exercise is important for all of us. Again, for 100 reasons, it's important to exercise. It is the case, however, that for weight loss, for active weight loss during an active treatment phase of weight loss, diet tends to have a more powerful effect for weight loss than exercise alone does. Okay? Once you've lost weight, exercise is critically important for keeping weight off, but to just try to lose weight by exercise alone doesn't usually work very well. A combination of both, of course, is what we recommend. But it takes about 60 minutes a day is what we recommend for the weight loss phase of weight loss, and then 60 to 90 minutes a day to keep weight off. It's a lot of exercise. It's an awful lot. And it's not that you have to do it all at one time. You can accumulate. This is the beauty about burning calories. Anything you do in movement burns calories. So you can accumulate this physical activity throughout the day. When you talk about cardiovascular health, then you talk about wanting to exercise for a certain period of time at a certain level in order to improve your aerobic capacity or your fitness. We're really talking about just moving your body, gross movement, right? So if you can do a number of 10-minute walks, that's good for weight loss. Okay? And this is really an illustration of why it's nearly impossible to lose all the weight that you want to with just doing exercise without controlling your food intake. So I took this example. I was looking at this morning. It's apple season, right? Apple pie season. So if you had a slice of apple pie, you would have to walk for 52 minutes at 3 miles per hour. That's about a 20-minute mile, which is a reasonable walk. Not too fast, not too slow. 52 minutes. Okay, so think about a lot of extra calories. I just told you to subtract 5 to 1,000 calories out of your daily food intake. If you were just going to do that with exercise, that'd be a lot of hours in physical activity. That's why it doesn't work so well. It's really hard to exercise that much. It's really easy to eat it back, right? How long would it take you to eat the piece of apple pie? 10 minutes, maybe 5, right? Okay. And then it's 52 to walk it off, right? Not very good odds, right? So it's a lot of exercise to just do that. Now, having said that, if you feel like your energy intake really is in control, but you're very sedentary, for someone like that, where the clear problem is only on the expenditure side, exercising might really solve it all, okay? But usually it's a combination of both things. Okay. The other thing we suggest is really to do, as I said, little increments. Every little bit counts when you're talking about weight loss. And so we divide things into what we call programmed exercise, which is really thinking about, going for a purposeful walk or going to the gym or doing an aerobics class or a spinning class or something like that, versus lifestyle exercise, which is just really moving more, taking the stairs instead of the elevator, parking farther away in the parking lot and walking, not being so efficient with your movement. So don't get all the grocery bags from the car at once, load them up and carry them in, go back, keep going back, And, we do all this stuff in our lives now to make it easier for us, right? We just got this new amazing, printer copier thing at work. So I do not even have to leave my desk to fax something. I can sit there on my rear end and do everything. I don't ever have to move, right? So, now we're talking about, after we've done all this stuff to make our lives easier, undoing it now, okay? So we have to be much more active. And, one of the things that people talk about at work is we all have these standing desks now, so you can stand up during the day and work and do your email, so we're not sitting all the time. And there also are treadmill desks. Have you heard about those? So you get a treadmill kind of under your table, and you can walk very, very slowly during the day, 1 mile per hour, but it's enough that you're at least moving. We do see that sedentary behavior is just as bad for you as not being active. So you can go out and do the recommended amount of physical activity every day, which the CDC says is at least 30 minutes, 5 to 7 times a week, right? You can do that amount of activity. Say you go for a run in the morning. If you then go to work or stay in the house and sit on your rear all day long, that's just as bad as not doing the exercise in the first place. So we need to do the exercise, but we also need to just not be as sedentary during the day. And one of our more sedentary activities is watching television, right? So this comes from a study that a doctoral student of mine did, Jen Otten, where she went into people's homes and she decreased the amount of television they could watch by 50%. So whatever they were watching, it didn't matter how much, she decreased it by 50%. And she measured their physical activity before the decrease and after the decrease, and she measured their eating behavior before and after. Because, our hypothesis was that people tend to eat in front of the television. Maybe if you turn the television off, they'll eat less. And we weren't really sure what would happen with activity, So you can turn the television off and then sit on your rear and read, right? So do you just replace a sedentary activity with another sedentary activity, or do you get up and move around? And what she found is that people got up and they moved around. So when she decreased their television time, they weren't exercising necessarily, but they were doing the laundry and washing the dishes and shuffling around the house. And so they had a net increase in energy expenditure of 119 calories a day. They also had, and I didn't put this on the slide, they had a net decrease of about 100 calories in consumption. So their energy balance improved overall. So I'll take a question after, if that's okay. So, I also want to say that it's really important to get support when you're going through this. You all know that, being cancer survivors, you need support during treatment. You also need support during your weight management, lifestyle change goals, right, to support that. So this was a study that I really like because these individuals were asked before treatment whether they thought they would do better to be treated as individuals or to be treated in a group setting. And so once they knew what participants' preference was about treatment, they randomly assigned people to either get what they thought they would do best in or to get something else just at random. And it turns out that everybody did better being treated in a group than they did individually. Even if they thought at the beginning of the study that they would do better in treatment individually, they did better in a group setting, okay? So support is really important. There also have been studies where people were asked to come into the study with a friend. Like, you couldn't be in the study unless you came to the baseline assessment and the screening with a friend who was willing to do the weight loss with you. What happened then is, sadly, some people got randomly assigned to do treatment with their friend, and some people got randomly assigned to do treatment without their friends. And it turns, I know that's very sad, but it turns out that if you came in with your friend and you did treatment with your friend, 95% of those people completed treatment and 66% maintained their weight loss. If you came in alone, 76 completed treatment and only 24% maintained their weight loss. So having a buddy to do this with you is apparently a highly effective strategy, right? So I would encourage you all to think about that. Okay. And then ultimately in the end, as I said with diet, when you're choosing what it is that you want to do, have a long-term view, right? Diets fail because people see them as diets. It's something to go on temporarily to lose weight, and then you go off it again and you start eating the way that you used to. If you keep eating the way that you are now or the way that you used to, you will be the weight that you used to be, okay? So if you want to be a new weight, you have to eat a new way. And the only way to manage that is to pick something that you know that you can follow through with for a long period of time. That is exercise as well as diet. So think about the long-term view. You didn't gain this weight overnight. You're not going to lose it overnight. It will take some time. But ultimately, in the end, if you fight like a girl, you can do it. Okay. So thank you, and questions? Yes.
The girl who did this study about decrease in television,
Yes.
did you take into account also that you're getting less commercials for food?
Oh. No, we didn't take that into account, but that might have been helpful. I mean, it is possible that that is one thing that prompted people to not eat as much. Yes, could be. Good point. Other questions? Yes.
In terms of regulating your fat to muscle composition, you can't easily do that like you can stepping on a scale. So are there things that you recommend that, without buying like a $200 device, that you can, kind of monitor that for yourself personally?
Yeah, well, there are scales that will tell you what your body fat composition is. I don't think they're $200 anymore. There are some models that will do that. They use a form of bioelectrical impedance. You step on it and it kind of arcs through the lower part of your body. So you can do that. You can also see if you can have it measured. I know that I don't know if you're from this area, but there is an onc rehab program that is running now, and they may be able to do some body composition testing for you. But you're right, it is hard to know exactly what your body composition is. There is some evidence that weight training also helps you to kind of regain your muscle mass again. So adding weight training on top of an aerobic activity program could help you restore your body composition. Yes. Yes.
I recently saw some of those scales, and they weren't expensive at all. I mean, I think I saw them from anywhere from $40 to $60.
Yeah.
I was wondering how accurate they were.
Yeah, I think that they're reasonable. You know, when they first came out, they were very expensive, and you're right, they were probably over $200. They're cheaper now. So I think that they're reasonably accurate. You would at least get an idea of change if things were shifting, I would think. Other questions? Yes.
So if you have a woman coming into treatment, do you generally have them try to start, if they've been a sedentary, do you try to start an exercise program at that time, or encourage them to do something during treatment?
You know, I think that it is encouraged to do something during treatment if you can. Yep. Why wait? You know, I think the fatigue is obviously greater during treatment, and so you can do what you can. But often, you know, if you try to do something, you are going to feel better. You'll feel less fatigued. So there's no guidelines about how much you should try to do, but I think doing anything is better than doing nothing. And certainly, I mean, my experience was, you know, that there were certainly, depending on your chemo cycle, there are days when you're in bed, right? But when you're not and you start to feel better, capitalize on those until you have to go under again. And you pretty quickly learn when you're up and when you're down, right? Yeah. Anything else? Okay, well, I will be here for a while till we get chased out of the room. So thank you.